Hello.
Hey, Dr. Ballin. Hey, nice to meet you. My name is Yuki. I'm the nurse looking after Jimmy here. All right.
Hi, I'm Dave. I'm RT.
Yeah.
You just called, I think.
Yeah, exactly. So Jimmy, the doctor's here. Okay. So as you can see, I mean, this hasn't gone down a little bit. His pressure has gone down a little bit too. So we weren't too sure what's going on. So we're hoping you can come and help. Yeah.
So this is new. This is the hypotension and the tachycardia.
Yeah, I mean his heart rate was 100 or 90 to 100 before, and then his blood pressure was always kind of over 100 systolic and mean, so it's been getting worse. Yeah.
Can you put some oxygen on him? Try to keep it above 95.
Yeah, he's on 100%.
He's on 100% right now. Okay. And he has IV access of some sort.
Yeah, he's actually his cordis is still in right now. And he's got an 18 gauge and a 16 gauge in his.
So can we start a liter of saline?
Sure. Yeah.
Actually, we'll give 1 liter under pressure.
1 liter.
Pressure bag.
Okay, I'll get that done. Yeah.
Jimmy, how are you feeling?
My breathing in my chest really hurts.
Is he in pain in his chest?
I think that's what he said. Yeah, he was
Yeah.
coming a little bit earlier.
Yeah.
Too.
Yeah. Okay. Are you short of breath?
Yeah.
Okay. Have you had this pain before?
No.
Okay. I'll just have a quick listen here. Take a big breath for me.
Yeah. Yeah.
Okay. Liter pressure bags up.
Great. Thanks. Okay. So he's got reasonably good breath sounds on both sides. I think a little decreased on the left, but not significantly different.
Okay.
So we're dealing with hypertension, tachycardia, hypotension and tachycardia, sinus tachycardia right now, and he's hypoxic, which is kind of my main concern right now. He's on 100%, is that
Yeah,
right?
that's
I know he
correct.
has a difficult airway,
that's what I heard from
so I'd like to
anesthesia.
get some support here.
Can we just help him breathe a little bit?
Sure, yeah. If you want to give him some positive pressure,
Yeah.
I'd like to call anesthesia to
Sure.
have him close by.
Okay, I'll give
Actually,
him a call. Yeah.
Jimmy, I'm just gonna help you breathe a little bit, okay?
This is anesthesia. Can we get an anesthesia resident or someone from there to come down to the ICU staff? We got a guy with a previous difficult airway, and we may need your assistance right away. No wait, thank you. So the anesthesia resident's tied up in the trauma bay right now, but she'll try to come up as quick as
Okay.
possible. Yeah.
Okay, so I'd like to get some other support here nonetheless. So I have RT. If the staff is close by, I'd have them a little.
Sure.
You
Yeah.
know, have them aware of the
My
situation.
chest.
Obviously, this patient.
Sorry, what was that, Jimmy?
My chest really hurts.
Your chest, and you never had that. So that's
Okay. So can we get a stat EKG on him?
Sure, yeah,
and,
yeah.
And
Yeah.
a chest X-ray. Call for one.
okay. I'll call for a chest X-ray.
Okay.
Could you just stat chest X-ray and EKG to the ICU? Yep. Okay, thank you.
Okay. So after the first one is probably on it. The first bag is probably on its way in to give him another liter.
You okay?
Right now I'm thinking more of respiratory and cardiac issues.
There's EKG. Chest X-ray's on their way.
This is EKG here.
Yeah.
Okay. Okay. And what kind of history does he have?
Let me just have a look here. So his history is
Sorry, I'm just noticing his rhythm change. Jimmy, can you talk to me, Jimmy?
Is this saprobe still on there?
is that maybe it fell off or something? I don't know.
Yeah, just gonna see if we have a pulse here. Okay. I don't have a pulse. Can you bring the crash cart over?
Yeah.
So, bring this down. Yuki, we're going to start with the board first,
Okay.
and then Yuki, I'll get you some compressions.
Board on.
Jump on compression. So I'm going to go call a code here. I guess we're in the IC, so we might not be doing that, but yeah, so we'll start with compressions. I'll hook them up to the monitors. Okay, so I'm not sure how you feel about trying to get a definitive airway.
I mean, if anesthesia is having difficulty with it, I don't think I'll be much better with this, but I can at least get the airway stuff ready if you want to come back.
Sure. I'll have you bag for now, actually. I'd like to get some more support here. Just have someone record. I'd like to have someone on meds and someone to man the crash cart if we can get someone over here. So this is A guy who's just post-op day 2 after elective AAA repair, which was uncomplicated, presented with acute deterioration, shortness of breath, and chest pain, and had a cardiac arrest. So actually, I'm going to get you to let the analyze the rhythm here.
Okay, can we stop?
Yep.
Okay.
And I'm just going to check his pulse. Sorry, yeah. So there's still no pulse, so I'll jump on compressions here. Yuki, I'll get you to
okay.
drop some epinephrine, 1
Okay.
milligram.
Okay.
And when you have it drawn up, you can administer it IV.
Okay, I got epinephrine here, going through the central line here. Alright, milligram epinephrine in.
So actually, I should have been more clear here. So I think what we're looking at when I analyzed the rhythm was VFib. So what we really should be doing is shocking as soon as possible. So
Okay.
it's going to be unsynchronized. We're going to have 200 joules.
Okay.
And once you get it charged, we're going to step away.
Okay.
Yeah,
Shock
step away.
ready? Everyone's clear?
Administer, yeah.
Shock delivered.
Okay, I'm going to jump right up, back on compressions. So we're going to do this for 2 minutes, and then we're going to analyze the rhythm again, and I'm going to feel for the pulse. Actually, Yuki, if you're just standing there, could you grab his femoral pulse and
Sure.
just let me know if the compressions are adequate? We're getting some help along the way.
Yeah, I can feel compressions, yeah.
I think it's been about 2 minutes.
Okay.
Yeah.
So we're going to analyze the rhythm and feel for a pulse.
I still feel a pulse here.
Yeah, okay. So now I'm going to think about kind of our H's and T's, even though we've regained circulation so far. So hypoxia. He was slightly hypoxic. I don't think it was enough to kind of explain the arrest. Hypovolemia, certainly a possibility. We're on our 2nd liter of fluid under
Yep.
pressure.
Correct, yeah.
He's still a little hypotensive. I'd give him at least a 3rd liter. And then after that, I'd start thinking about vasopressors. Acidosis or H-ion acidosis will send off a gas right now.
Okay.
So art line.
Get that gas.
Gas.
Right, yeah.
Hypothermia, I think it's unlikely. He feels warm to me.
Mm-hmm.
Toxins, just have a quick look at the drugs he was given, in the last, since he was extubated or before extubation, sometime today.
Okay. Gas is sent.
Tamponade, cardiac, so based on the exam, I'm going to look at his JVP, his heart sounds. I can have a quick listen here. So, just quickly, they're not muffled, and I hear clear heart sounds.
Okay.
We're going to get a chest X-ray to rule out a pneumothorax.
And they're on their way, yeah.
They're on their way. Do you guys know the other one? So toxins, cardiac tamponade, thrombus. So pulmonary thrombus, cardiac thrombus. Certainly could be having an MI, certainly could be having a PE. We can actually, if you get a chance, could you please set up a heparin infusion?
Sure, yeah. Get that for you. Yeah.
Before you hook it up, I'm just
Thank you
going
very
to...
much for taking the notes. That's the end of the scenario.